This afternoon, the PPI groups from the PICE, and we are going to be talking to you about some of the issues that, broadening the field of public involvement. So we have been asking you lots of questions, so this is your chance. So thank you very much. We have lots of questions, and we are very, very happy that you could ask us questions. And to start off, we have Ian and Ross and Steve and Lisa. So that's your panel. I'll be co-chairing with Steve. I'm a bully, so I always tend to chair things. But I'll hand over to Steve. So to start us off, I just wanted to reflect on what we've been listening to throughout the day. And so one of the major questions that you guys asked us is, how do we do public involvement and public engagement? And where do we find the people? So to my surprise, all the presentations I listened to, I think except for one, where I wasn't sure where there was involvement, you have all been doing public engagement and involvement. The mental health study talked about having a young people's advisory group. So that's one strategy as well. The group that talked about universal credit, they already have a lot of PPI within their work. They actually gave us a whole slide that had activities, very interesting activities, poetry, photography, exhibitions of how to engage the public in their research. And they also talked about how they got to the people via community organizations. So sometimes when things are introduced, or when the funder says you actually have to have this, you sort of think about it from a very high level, and sometimes it's not that deep. You're already doing it, but it has just been put in a particular box to say, PPIE, you have to do this, and we have £5,000 to give to that. So you sort of think too hard on that question. So you're already doing it, and you're already doing great. The Kara project talked about having a partnership with Consortia. So already people are doing PPIE. The Deepen Network talked about co-creation. So these are the words that we use when you talk about public and patient involvement, of what kind of involvement you want. Do you want just an advisory, tokenistic kind of approach, or do you want the full-blown co-creation or co-production kind of approach? So you've all been using different kind of approaches, which are all very good. And not every study, to be honest, needs PPIE. Not every study. But studies that do need PPIE, there is no one-size-fits-all. So you'll hear from the panel what they think and how you can involve certain populations at different stages in your study to be able to fulfill that. We also just heard from Emma on the homelessness study, and I think she gave us quite an interesting view of how she recruited people and what sort of relationship and what sort of things that she had to put in, and time and being flexible for her to be able to access the homeless community. Having said that, so I will go on to the first question and hand over the next session to Steve, who will answer the question. Oh, you've got yours. Okay. All right.
Before doing that, Rosemary, do you mind if I say a few more points as well? There are a number of sort of background issues, I think, that need to be thought about. We've heard some excellent examples today. I have to say it's been really uplifting to hear the sort of instinctive public consultation that's happened in all the projects that we've been talking about. And the project I've been involved with as well, the tobacco project, I think has been a really good example of feeling involved, engaged, the right sort of people in the right place at the right time. But there are several general issues from, I'm sad to say that's not always the case in all the, the public contribution roles that I've fulfilled. And quite often there's a sense of being tokenistically involved, which I think is something that we try and address as fully as we can. But in order to find people to get engaged with public contribution, they have to feel it really makes a difference. This is not just a cliche. They have to feel like their contribution is going to be valued and will influence the way things develop. And the reason why I raise that is because you almost need to start at the finish before going back to the start again, which is how is the material disseminated on previous research projects? Does it reach local people? Does it reach people who are often marginalised and excluded from public involvement. If the dissemination of successful projects is not reaching people through the radio, through newspaper, through TV, then actually you're missing a way of persuading people that getting involved in public contribution is useful and influential. The second point I would make is one of the speakers today, with a sense of urgency, said that sometimes we need to do things speedily. Yes, but speed quite often excludes people that need time, and where relationships need to be developed in order to make people feel that they are valued contributors. So slowing down is good sometimes too. We all want things to improve quickly, but actually in order to develop the depth of relationships with the groups of people that are often marginalised and excluded, that takes time. And with that as well, a sense of partnership. So the researchers have got to build a set of networks and relationships over a period of time, having identified, I usually talk about stakeholder mapping when I'm talking to researchers about the first stages of their research journey. How do you know who's out there, and how have you worked out who are the people that really need to be the most involved, and then develop the tactics for doing that. Yeah, speed isn't always good. Slow it down, make the relationships. One question that often comes up in my mind is, who chose this research topic? And quite often research topics are planted into communities where we thought this was a good one to look at. And actually, if you'd asked the communities beforehand what were their priorities, they would probably have come up with different answers. So those are the additional points I wanted to make. Rosemary, do you want to add anything at this stage?
No, I think you've covered that very well.
Hello. Yeah, I just wanted to add to that from a disability perspective. And we often hear the term hard to reach. I've heard today unreached. And I think that's it. That I think anyone's hard to reach if you don't make the effort. And I think that for me, disabled people are often seen as a hard to reach sector or a hard to reach community. But I think it's about making their involvement inclusive and making it welcoming so people feel a part of it. I've been on programs where I've been asked those tokenistic questions, and to a person who wants to be involved, it's really obvious when you are. There is a tokenistic gesture. I think it's a lot harder. It's an ongoing process to keep people involved, and I think that's the challenge that we all have. I think that's my opening.
Thanks a lot there, Ian. We also have other members from the PICE group and other community engagement groups. Do you want to say a word?
No, I wasn't prepared.
Is there anyone who's a community member who wants to say something before we go on to questions? Yes, Don. Thanks, Karen.
Oh, God, sorry about that. Yeah, I was just totally agreeing. You need to build a relationship to get people to become involved. People aren't going to give you their full, not their full stories, but people aren't going to, willing to become involved if you don't build some sort of relationship with them.
Thanks, Karen. Lisa.
Oh, thank you. Just to add from my colleagues, today's been, it's been really, really good to come and see the presentations and to meet everybody out there. I've been working in communities for a long, long time, supporting community members, and I'd just like to say that, you know, it's so important that, you know, research projects come from the community themselves. You know, you will get better engagement, participation, you'll get the lived experiences, you'll get all the richness that is out there that you can capture, which is so powerful. And I think the film that we saw today on the presentation, on the distress one, you know, it is just so powerful. And I think, you know, the community needs to be the driver of the research that is out there, supported by everybody and working together, because we can achieve so much more by working together. And I think by listening to people, building the trust, valuing their input and feeding back as well is so important to all of us to feel valued and to be part of the community. So that's just from my perspective. Thank you.
Thank you. I also wanted to just add one other point from one of the I think it was the Universal Credit Study, where they say that they've done quite a lot to try and reach out to communities. So I think there's always that balance and that honesty that I'm now seeing with researchers to say, well, I tried. You said I should go out and try and get the BAME community. I went to their service organizations. I went out into the community. I put it up everywhere, the GP's office, NHS. I really tried, but I only got 2 people. So as long as you've shown your commitment, as long as you've done your part, ask maybe the PPIE members to say, so, you know, we've tried this strategy. It hasn't worked. What else can we do? What else, how else can we enroll people of your color or of your background in the disability sector? How else can we do it? And then we help each other, because the idea, I guess, is to have the end user get the best outcome, health outcomes. And I think we all want to work towards that. So I'll ask Ian one of the other questions. Is what do you like best about being a PPI group member so far?
I think with PPI I do feel included, and I think my voice is valued within that. And I'm going to go back to a previous experience. So now I've done work with Felicity through the Northeast PICE, but prior to that, I worked for a charity that was a user-led organisation, and we carried out user involvement to where we interviewed several focus groups of people about health inequality. So I'm talking about 10 to 15 years ago, and we wrote a massive report, but because it wasn't written in an academic manner, it wasn't accepted by authorities. So the parts of that report were then written by academics, and those parts were picked up. So I think we've recognised that we need to work with academics as well. So I think it's a two-way process. And I think that it's that thing that you've just said, that you need to build a partnership and build relationships. And I think that's ongoing, and people will come and people will go, but I think the process needs to be strong and sustainable.
For me, it's the times you can look back and see a direct connection between your contribution and making a difference. The argument about developing partnership, sense of partnership, I come from ARC West in Bristol, and because of the conversations we've been having in Bristol and some creative thinking, a role called ambassador has been developed, and we pay 3 young people from communities in Bristol that have not been actively engaged in research projects. We've paid them for the last 6 months or so to go and find out what local community people are thinking, what issues are a priority for them, especially those that might lead to research projects. And things are looking really good. We're getting different sorts of feedback, different quality of feedback. And we're going to be adding, supporting those young people through additional training to help them develop as individuals as well. So we're beginning to see quite a different type of issue emerge, because we've accepted that we systematically avoid hearing that voice unless you take different steps to adjust the way that your system works. So it's been really positive and looking really good for the future, and a really nice model, Ian, because we can see that applying to other groups of people who are on the margins of this set of activities. So we can see it as a working model for the future as well. And it's great to be able to see that emerging from a conversation over the last couple of years.
I think for me, it's all about making a difference and being part of that difference and supporting other people to come on board, helping wherever we can to support communities, to support public members, however way, shape or form they can, and just be adaptable to their needs. So yeah.
Great. So for me, I'll give the example of Emma's study, where she talked about, now that you have the data, sometimes making sense of the data takes someone who has lived experience to explain certain parts of the data that you then produce at the end of the day. So for me, I have worked a lot with designing PPIE work across the world, and what I've seen is at that point where someone has data, a lot of times when they do present their feedback to say, or their monthly feedback to say, this is where we are, and progress reports, a lot comes out of the community members to say, oh, okay, so you probably got that data or that recruitment because it was the wrong season. This was the farming season, so you probably won't find any people in that age group. They will be busy. And the researcher quickly thinks, oh, okay, I just need to redesign this part. And they go and do that, and it helps. So that's what I really like, for us to help you make sense of the data that you collect. Because at the end of the day, if it's going to be sustainable, if it's going to be something that we are the end users, we might as well tell you before you publish or before you interpret it to say, well, that necessarily doesn't mean what you think it means. I think, she talked a lot about, sorry, I'm very biased towards Emma because I work in mental health. So, yeah. So at the end of the day, it's us helping you make sense of your data. Yeah, I think we have time for another 2 more questions. 2 more, okay. All right. I'm trying to look for a question that's slightly different. What are the biggest barriers to people being able to engage? Ian, do you want to start?
Again, I'll speak from the perspective of a disabled person, but for a starting factor, access is a massive issue. And when I talk about access, I'm not just thinking of physical access, but I think there's a danger that things could go all online and or via various polls and that type of research. I think that for me, there's various ways of carrying out involvement, but I think that you've got to, I go back to valuing the people, and you've got to really meet the person's needs. And to do that, you've got to do a range of different options of how to include people. So physical access is one barrier, transport is another, but I'll always have those barriers. I much prefer to get to somewhere and be like we are now, face to face. So I think having done all the online for 2 years, I think everyone's got their own experience of that. So personally, I think you need to make sure that people aren't isolated, and involvement for me is about making it inclusive and making it so people are fully included, involved.
I think there's a general feeling of disempowerment, a feeling of lack of trust that your opinion can make a difference. So I think that happens more broadly in society rather than just in the research world. So I think a feeling that people don't see a connection between them having a strong opinion and it being possible to make changes. So I think building the connection between the two is going to be necessary. Last point for now. The other thing is I think we need to have different methodologies, different ways of taking people's opinions and offer a range of different options. My own work experience has been in people with learning difficulties over the years. There are 1 million people, citizens with learning difficulties in the country. Are they involved in our research routinely? I'm not sure. Actually, I haven't seen it very much. So what does that mean in relation to our style of presenting choices for getting involved? So I think having a menu of different ways of engaging with people and recognising that research often needs to be slow and really flexible is a really important part of it. And I don't think people realise that that those opportunities could exist if they were more assertive about it.
The experience that I've come across is folk not having the confidence to get involved, to feel supported. I think like Steve's just said as well, it takes time to build trust and relationships, and especially you know, trust is a big issue out there because, you know, 1 minute you're there, the next you're gone, and that is all a lot of community members see. You know, oh, you know, they feel quite used in some occasions, and you know, you can offer incentives for people to get involved, and you know, that's great. You know, you might offer them a food voucher, but is that really valuing their input? That's just my observations. So I think lack of confidence is a big thing out there. Also, folk have got, you know, lots of responsibilities, caring responsibilities. I take my hat off to them because I don't know how they coordinate everything, and as well as helping, supporting, wanting to be involved, having a family, having carers commitments, having you know, but there is people still out there who want to help because they do want to make a difference. They want to make a difference for the community, for their family, for their children, for grandchildren, so they can make a difference. Some of the barriers that we've come across are, I think, like some of my colleagues have said, is the digital aspect of things. People prefer the face-to-face, and that gives a more personal touch, and that gives the value to things. And you will know that, you know, for folk to be involved, you know, they can carry that on for a long time. It doesn't have to be for the process of a project. They will still carry that on, being involved. So just some of the other things, again, is time. And some folk as well, it's because it isn't something that will impact them personally, that they haven't brought to the table, or the need, again, it's having it done to them rather than the other way around. Okay.
I just wanted to make one more comment, and it was, it's to back up something that was said in one of the earlier presentations this afternoon. That I've found over the years that involvement when it comes down to budgets is a massive thing that falls off the end of the cliff, and I think it's often one of the first things that goes, and I think I've witnessed that over the last 20 years. Whenever there's budget constraint, the involvement side goes, and I think that that's a really important thing that we all fight to keep a hold of.
Thank you. Oh, my final say. Oh, okay. I was just about to sing. Okay, so there was a question on support. Ask your peers, ask them what they are doing, find the one who has the best program or who has succeeded, and ask them how they do it. People always have information with them. Training, there's lots of training. I know the NIHR is offering a lot of training, and you'll see some of our faces in that training. So the training is not only academic. So I think not everyone is a people's person. So you need to identify within your team who is the best person to sort of, especially at the initiation phase. So you probably don't want someone like me who's talkative, big hair, big everything. You might want someone who's a bit calm, like Steve, who talk to people nicely, you know. Yeah, you know, someone who's calm, like Ian talks nicely and explains things, so that you don't sort of come out too strong. Imagine if I want to talk to someone, you know, in the homeless community, and I'm me. It will be hard for them to connect with me. They keep looking at me like, oh, does she even understand homelessness? I mean, you know. So those social skills, pick out in your team who's the best, especially at the initiation stage. And there's guidance. So the NIHR has guidance. Also, there is what's called good participatory practices. So we'll send to Ruth the links, and you guys can always have a look at that. It gives you a lot of insight. So last word, fine. Thank you.
Thank you very much. Thank you.